If you had a crystal ball, you could predict your future health care. And that would help you select a health care plan to cover those expenses. But you don't have a crystal ball. Hello, I'm Kevin Knaus with InsureMeKevin.com, and one of the vexing situations of health insurance is that we have to try and predict how we're going to use health care in the next year. Do we want one of those expensive plans to make the cost really low, or will we go with a less expensive bronze plan? And then there's the whole issue of these different metal tiers. It is nice in California that we have these different metal tier health plans that are fairly consistent whether you go through Covered California or directly off exchange. You know, we have the Bronze 60, Silver 70, Gold 80, Platinum 90. And even though the providers change for the most part, the benefits stay the same and the cost sharing structure for the member also stays the same. But there's just a lot of moving parts. It's more complicated than driving a tractor. So hopefully this might kind of help you out a little bit. One of the things to look at first off on these different middle tier plans, and this is for the standard benefit design plan, is the maximum out-of-pocket amount. So for the bronze, $9,100. Once you accrue $9,100 in healthcare expenses and prescription drug medications, you're done. Everything's covered 100% for the rest of the year. Silver is also $9,100, Gold $87, and Platinum $45. Now you will also see that as that maximum out-of-pocket amount goes down, the premiums go up. And so that's something you're going to need to balance as you're looking at some of these plans. But there may be other situations in your life that will help you gravitate towards one metal tier or another. One issue I kind of want to clear up is the medical deductible. Most of these plans don't have a medical deductible as we think of it as in the past. The bronze, you will get a few office visits at a set co-payment and whatnot, but that $6,300 medical deductible, you generally have to work through that. Then you go into 40% co-insurance. That's where you pay 40 cents of the next dollar over $6,300 and the health plan pays 60 cents. With the silver plan, that medical deductible of $5,400, you do not move through that for most of your routine services and even outpatient procedures. You are only subject to the medical deductible if you are hospitalized or in a skilled nursing facility. So it's kind of a moot point for the most part on the silver plan. The gold and the platinum have no medical or pharmacy deductible, so you don't have to worry about it. So that's kind of nice. I wouldn't be as concerned about a medical deductible with a silver plan if you're thinking about that, unless you know that you're going to have a hospitalization. The heart of a health plan for most people are the routine services, seeing the doctor, labs, tests, imaging, x-rays, things of that nature. That's 95, 99% of what we're using in a healthcare situation. And most of the silver, the gold, and the 90 are going to have set co-payments to help reduce those routine healthcare services. You have to be careful with the bronze because they only have a few set co-payments for those routine services. So that's going to be the heart, but as those co-payments go down for those metal tier levels, the premium goes up. And one of the things that is, can hurt right off the pot is if we do get hospitalized. And the health plans, they kind of treat that differently. Again, with the bronze plan, you're going to have to move that deductible, then it's 40%. The silver plan, if you're hospitalized overnight, inpatient, then you have to move through that $5,400, then it's 30% co-insurance. That means you pay 30 cents of the next dollar, health plan pays 70. Gold, no medical deductible, 30% or a copay. Platinum, 10% or a copay. Now that copay generally shows up in HMO plans. And that can be a good deal. That can really reduce your out-of-pocket costs, but it is with pretty much only with HMO plans. All of the metal tiers kind of they have a drug formulary, but they treat drugs differently. There really is no prescription drug coverage with the bronze. With the silver, gold, and platinum, you'll see that the co-pays for the different drug tiers decrease as you get up higher in the metal tier. And that can be a tremendous help for folks that are taking, brand name medications to help contain the costs. So a couple rule of thumbs that I use when I'm working with clients. We want to give strong consideration to silver, gold, and platinum plans if someone is taking multiple prescription medications, because those will have help for that prescription costs. If they're managing a chronic health condition, they expect to see a doctor on a regular routine, every couple months. Maybe they're getting labs, tests, x-rays, or they have a planned hospitalization or maternity. Those people strongly need to consider silver, gold, or platinum plan. Now, it is nice in Covered California that maybe you are managing a chronic health plan, but your partner, your children aren't. You can be in a silver, gold, or platinum plan, and the other family members can be in a bronze plan. That helps reduce your health insurance premiums. The bronze plan, some people look at that as purely just asset protection. They do not expect to use any healthcare services at maybe an annual physical, which should be zero cost. But no real need, no planned surgeries. They're just going about their life, and the bronze plan can work just fine. And they know that if there's a big accident, it's going to be $9,100. And they're done for the rest of the year. And once they pick that up, once they meet that maximum out of pocket, the health plan pays all of the in-network costs and prescription medications for the rest of the year. There is also the Bronze 60 High Deductible Health Plan, which has a lower deductible and maximum out of pocket of $7,050, and there's some tax issues there and whatnot, and I'll address that in another video. But kind of the bronze, you don't expect anything to happen, but sometimes people will use the bronze plan if they know they're going to have surgery the next year. Okay, I'm having my hip replaced, I'm having one of my knees replaced, I know I'm going to hit the maximum out of pocket. They do it, hit the maximum out of pocket in January or February, and then pay the lower bronze premium for the rest of the year, while the health plan covers all the health care expenses with, in-network physicians and providers for the remainder of the year. So that can be a good deal if you have the crystal ball about what your health care will be like in the next year. If you are offered an enhanced silver plan through Covered California, either the silver 73, 87, or 94, strongly consider enrolling in it, even if the bronze plan is zero cost. And maybe the silver 87 costs $100 a month or something. Really look at it, because look at that maximum out of pocket. See how it drops for the silver 73, 87, and 94. That's really, really good. That's your maximum liability. And of course, many of the routine co-payments will be lower, and so will the co-insurance. So yeah, you may not be anticipating any issues in the coming year, but if you're offered an enhanced silver plan, really, really consider it, because it's a very, very good deal for the money. One of the difficulties with these health plans is we do not know what our health care is going to be, what we're going to need in the next year. And it can be cumbersome to run the numbers, these different scenarios. So I have created one scenario just to kind of see how the silver, gold, and platinum plans play out, including the premium, because that's what scares most people, is the monthly premium for those gold and platinum plans are very expensive. So what I did is I created this hypothetical individual with a scenario where they have 6 primary care visits during the year, 6 specialist visits, 2 urgent care visits, 6 lab tests, 1 emergency room visit. They have a hospitalization that nets out at $100,000 and an outpatient procedure at $3,000. Then I also put in that the individual is taking 2 tier 1 drugs, 1 tier 2 drug, and 1 tier 3 drug, and they need those refilled, a 30-day supply. So with the silver plan, you can see the red numbers there are how much the co-pays and co-insurance is going to cost. The big thing, the hospitalization. It is not only the 30%, you have to move through that deductible of $5,400. Then I added on the 30% of the remainder. So that hospitalization, the individual's on the hook for $6,780. Outpatient procedure, straight 30%, $900, not too bad. The prescription medications, you'll see that the tier 1 actually is a little low, but that's because you need to move through the pharmacy deductible, and I had to add that in. So you have a pharmacy deductible of $150, and then you can see all the other costs. So when you total up all those red numbers, it comes to $11,626, but there is the maximum out of pocket of $9,100. So that's all the person would pay for the Silver 70 because it has that max liability. The Gold, same scenario with the same co-pays and everything, $7,260. They do not meet the maximum out of pocket of $8,700. With the Platinum plan, all of the same healthcare services and prescription medications, $2,500 out of their pocket. They do not meet their maximum out of pocket. But how does that look when we then add in the annual cost of the health plan premiums for a full 12 months? So what I did is, it's kind of hard, but I kind of took a middle of the road health plan of Northern California, Western Health Advantage, 50-year-old individual, and the annual premiums for these plans. The annual premiums for a Silver 70 is $8,052, and add that to the $9,100 for the cost of the healthcare services, $17,152. The Gold had an annual premium of $10,252 for a total out-of-pocket cost of $17,512. So a little bit higher there because of the premium. And then on the Platinum, the annual premiums were $11,286, and the total healthcare in premiums was $13,786. So in this scenario, if you could predict your healthcare costs, you would have a lower out-of-pocket accumulation using a Platinum plan. That's if you can, predict what's going to be happening. If you knew all the different drugs and everything that you were going to be taking, it can be, a little daunting to put this together, but, you're talking $4,000 or $5,000 for the year. Between the Platinum and the Silver. So it may be good to actually kind of run those numbers. Of course, that's if you have a crystal ball and you know what's going to be happening. But that's kind of how this whole thing kind of plays out. So the more you can do to estimate what your healthcare costs are going to be, and then figure out what the total premiums are going to be, you can make some better managed, informed decisions about what metal tier health plan is best for you in the next year, even though you don't have a crystal ball. So, for InsureMeKevin.com, I'm Kevin Knaus.